Meditech Electronical Medical Record for residency students. EMR systems enable hospitals to store and retrieve detailed patient information to be used by healthcare providers, and sometimes patients during a patient's hospitalization, over time, and across care settings. Embedded clinical decision support and other tools have been the potential to help clinicians provide safer, more effective care than is possible by relying on memory and paper-based systems. Did you know, despite the utility of electronic health records, hospitals were initially slow to adopt them? A 2009 survey of American Hospital Association members found that 1.5% of hospitals had a comprehensive EMR system, meaning that the system performed 24 specific functions and was used in all clinical units. Another 7.6% of hospitals had an EMR in use in at least one clinical unit. Hospital leaders cited startup and maintenance costs as major barriers to adoption. Training initiative. Who will be trained? What types of training will be provided? When will the training be offered? The extensive training that is required to teach staff and providers, along with residency students, to use the electronic medical record system is one of the larger costs of implementation and an important opportunity for realizing the transformation in care delivery that EMRs can bring. This issue brief explores some of the approaches and training, their influence on the implementation strategy, and the way they can streamline workflow and standardize policies and procedures. Also, who will develop and provide the training? Where will the training be held? How will the training be evaluated? Who will receive the training? Our initial goal is for residency students to retrieve the training and then understand how electronic medical records work within the hospital settings. How will the training be conducted? We have set up a 3-workshop based system where it defines the learner's outcome in 3 different areas: fundamentals, communication, and design, along with managing assessments and assignments. The first training session will be covered only face-to-face base. This is because new residency students will have an opportunity to ask questions, see firsthand of how the medical record system works. This will resolve all access issues that new residency students will have in their initial startup within the hospital. Our second and third training sessions will be offered in both traditional and online versions. Each residency student can select their own preferred training once they've been in the residency program for 2 years. Our support staff will be face-to-face meetings weekly to go over review the training manuals and tutorials. Also will play a vital role in the success of training initiative for the residency students, the new ones and the present students. The training phases. Phase 1 will be consisted for each fall semester for new residency students. Phase 2 will be quarterly for update use and functionality of the Meditech system. Phase 3 will be a as need per residency student. Also, our open labs will be open for residency students who have finished the training and want to come in and talk to trainers about how to implement the actual training that they've received to understand the new EMR system. Trainers will be on hand to help with the learning on the EMR system for the residency students. Training and training material. The training material will be provided by the IT staff at the hospital. Also, vendor and supplemental training materials created in-house from our IT department and from other vendors will be provided also. Training will consist of materials that will be handouts and downloadable PDF files. We will also have a dedicated training location in our IT department in room B535. Our evaluation of the training will be consisted of an IT created survey that will be sent out every 6 months for residency students. And The survey will consist of wanting to meet the training needs that we provide and also discover possible gaps that we're missing in further training. EMRs change the quality of patients' care as well as the way care is delivered and recorded. A strategic approach to training can turn those changes into opportunities for improvement and can help staff and providers negotiate the anxiety that always accompanies the change.